I'm Dr. Manjunath, your FMT guru. In this session, we are going to discuss important, very important long essays, short essay, and short answers. Rakesh, Rohit, Meena, I'm audible. Okay, shall we start? See, medical jurisprudence means application of legal knowledge in medical practice. It is opposite to forensic medicine. Forensic medicine is application of medical knowledge in administration of justice. Medical jurisprudence is application of legal knowledge in relation with medical practice, that is doctor-doctor relationship, doctor-patient relationship, and doctor-state relationship. And legal procedure. Legal procedure like courtroom proceedings, medical evidence, inquest, summons, very commonly asked in the exam. All good. Rakesh, Surabhib, yes, that's great. Okay, let's start. Now, in the beginning, look at this image. A case of history of abdominal surgery. The patient came to the doctor with a history of abdominal pain and vomiting and other clinical symptoms. During X-ray examination of abdomen, the finding here is the surgical instrument within the abdominal cavity or within the pelvic cavity. My question is it medical negligence? Yes or no? Point number one. If it is medical negligence, what is the section related to this offense? What is the BNS basically? Anyone, can you try? And what it is known as? The fact speaks for themselves. The instrument present in the abdomen, that speaks for the medical negligence of the doctor. What is that known as? Anyone? Yes, come on guys. Yes. So this is known as res ipsa loquitur. This is very, very important. The facts speaks for themselves. It is applicable to criminal negligence as well as civil negligence. The section is 106 BNS. The punishment is 2 years of imprisonment. 106, 2 years of imprisonment for criminal medical negligence. If patient dies, if there is a serious injury to the patient, then 106. All of you write in chat box 106 BNS. Just type this. Yes, good, all good. Murali, Mukul Roy. Yeah, today we are discussing some important topics, and at the end I'll give you some list of important topics. You can just go through that. Simple topics. Good evening, Suraveb. Good evening, everyone. Satyendra Maurya, Rakesh, Ranjan SN. Good. 106 BNS. Bahut badhiya. Chalo, this is one important concept. 3 marks question. What is res ipsa loquitur? What is the IPC section? So we discussed already. That's okay. This is criminal negligence. It is not civil negligence. It is seriously punishable. Now look at this. This is one more scenario. Here is a doctor and the patient. Doctor-patient relationship. DPR is established. Duty is established. The patient came with a history of pain in the left knee and the male doctor examining the female patient. I was telling, now will you please lift your t-shirt? I have to examine you thoroughly. My question is it legally correct? Is it ethically correct? As per NMC guidelines given. Can anyone tell me what is the mistake here? What is the loophole in this examination between doctor and patient DPR? Anyone? Can anyone try? What is this known as? What would be the punishment? Again, 3 marks question. Anyone? So here, male doctor examining female patient, that should be a third party. Chaperone, usually female attendant. Either it can be nurse or relative or any female during examination. That is compulsory. Point number 1. The point number 2, it can amounts to adultery, sexual intent, that is adultery. It is known as professional misconduct. What is this known as? Professional misconduct, or we can call it as infamous conduct as per NMC guidelines. Dishonorable, disgraceful conduct of a doctor, the punishable under various sections of medical ethics and the guidelines. The punishment can be either warning, point number 1, or it can be suspension of the license, or permanent professional death sentence. Removal of name of the doctor from the medical register, we call it as professional death sentence. Okay, good. Good answer. Rakesh is answering. Ranjan, very good. Bhumika Reddy, that's great. चलो बहुत बढ़िया. आगे देखते हैं. हाँ, one important long essay, very commonly asked in the exam. Define medical negligence. Mention 4D elements. Explain difference between civil and criminal negligence. Very important, 5 marks question. Sometime it can be main question also. Usually 5 marks question. What is medical negligence? So medical negligence can be of different types. Civil negligence, criminal negligence, corporate negligence, or it can be a contributory negligence. Okay, composite negligence. There are 5 types are there. Civil, criminal, corporate. It can be contributory, or it can be combined negligence. Okay? Yes. Good, Saurabh Chatterjee, that's great. In exam, you need to write definition from K.S. and Reddy. क्या important है? Important है definition. K.S. and Reddy, 35th edition, or any textbook. Okay, standard definition. What is standard definition? Absence of reasonable care and skill or willful negligence of medical practitioner in the treatment of patient which causes bodily injury or death of the patient. If death of the patient is there, criminal negligence, 106 BNS. If just an injury is there, it is a simple care, simple absence of care, then it can be civil negligence. The punishment can be compensation. So it all depends on the case. If it is consumer court, civil negligence. If it is criminal negligence, it is basically 106 BNS, 2 साल की सजा हो सकती है. ठीक है, चलो हो गया. Now remember, what are the tests for medical negligence? Can anyone tell me what are 2 tests for medical negligence? Saurabh Chatterjee from Kolkata, excellent. Excellent. Namaskar. Bhumika Reddy, बहुत बढ़िया. Duty is established. That's okay. What are the 2 tests? So the 2 tests are, one is Bolam test. Bolam and Bolito. याद रखना पड़ेगा. What is Bolam test? What is Bolito test? So there are standard guidelines basically. Okay, so all of you just type in the chat box bolam and bolito. BB, bolam and bolito. Try to write this. Write this. See, one time writing is equal to 10 time reading. Just type two tests. So you can make me awake. You can keep yourself awake in the class. So two-way interaction. It's very two-way communication. Very, very important in live class. Okay. Bolam and Bolito. Bhumika Reddy. That's great. Rakesh. That's fine. 40 elements. D for duty. D for dereliction. D for dereliction. D for direct causation. D for damage. So there must be a establishment of duty of care between doctor and patient. That is point number one. Second thing, dereliction of duty, negligence of the duty, not following standard guidelines, absence of reasonable care and skill, that is dereliction. Direct causation, this is very important component. So whether injury is directly related to negligence of the doctor or indirectly related, that is also important. So there are many parameters basically. So direct causation and the damage. So question can be asked, what is damage and damages? So damage is basically damage to the patient. It can be mental agony, it can be physical agony, it can be disability, anything. Damages is compensation awarded by the consumer court or the civil court. Question can be asked, what is damage and damages? Okay. That's fine. So then burden of proof. So the burden of proof basically depends on the patient or on the patient in civil negligence. In criminal negligence, doctor has to prove. So doctor must prove that he is not negligent by giving some evidence. So that is very important question. Then comes his types. What are types of negligence? There are 5 types are there. I said already, civil negligence, criminal negligence, okay, corporate negligence, contributory negligence, or sometimes there can be involvement of more than one doctor. So that is basically combined negligence, we call it as. So corporate when enter hospital at negligence. So basically they are related to medical negligence. So there are 4 types are there. Okay. 106, 2 years of imprisonment. So death due to rash and negligence, 2 years of imprisonment. Basically for doctor. If it is non-medico, then it is 5 years. A person dies due to negligence of the driver, then it is 5 years. Doctor, 2 years. So all these are important scoring points in the exam. So you must write all this. Definition लिखना है, बाद में लिखना है बोलम test. So बोलम test क्या है, बोलितो test क्या है. I'll send you the notes, you don't worry. 4D elements है, D for duty है, dereliction है, direct causation है, damage है, burden of proof, patient in civil negligence, doctor in criminal negligence, types 4 types है, civil, criminal, corporate and contributory. Contributory means both doctor and patient both are negligent. Civil means minor negligence in simple word. The criminal means very serious negligence, gross negligence. So then 106, 2 years of imprisonment. I hope you understood the basic points related to medical negligence. Yes or no? Suravib, Ranjan, are you okay? Chalo. Now look at this. Now Here is the patient. So the patient is having jaundice. The patient is having KF ring. So you are the treating doctor, you are physician. What would be the probable diagnosis? KF ring है, tremors है, jaundice है, hepatic jaundice. Diagnosis क्या हो सकता है? Wrong in diagnosis sometimes can be civil negligence, but sometimes it is very common in medical practice. Okay, what is this condition? Anyone? Anyone, can you try? What is this? So this is classical Wilson disease. Wilson disease, characterized by accumulation of copper in the liver, leads to hepatic jaundice, leads to KF ring, leads to tremors, bat wing tremors. The treatment is copper chelating agents like penicillamine, zinc, molybdenate. Okay? KF ring can be seen in various conditions. So this is reasonable skill and care. This is a reasonable knowledge you must have while attending patient. Okay? Yes. Wilson disease, बहुत बढ़िया. एक और देखते हैं. Look at this now. Here is a patient. The patient was bitten by some poisonous snake. You can see both the videos here. In one video, there is a ptosis present. The patient is having respiratory paralysis. The patient is unusually drowsy, excessive drowsy, sleepy. Now my condition, what is this diagnosis? What is the diagnosis basically? What is the best treatment in this case? Is it no treatment or some treatment? What would be the best treatment? Once again, look at this. Ptosis is there. Weakness of levator palpebrae superioris. Respiratory paralysis. Single breath counters test shows respiratory suppression. The snake is there, hood, spectacle mark is there. He was bitten by poisonous snake. What would be the accurate treatment in this case? Anyone? So this is cobra bite. Okay, Ranjan is telling, sir, cobra bite है. बहुत बढ़िया. Cobra bite में treatment क्या देते हैं हम? ट्रीटमेंट है ASV, एंटी स्नेक वेनम है ना, बहुत बढ़िया, मतलब बेस्ट ट्रीटमेंट. अराउंड 10 to 20 vials along with one more drug. What is that? Neostigmine. Then while giving treatment, there can be anaphylactic reactions. In that case, you can give CPM or hydrocortisone like that. So this is how, and right approach. Reassurance, immobilization, get to the hospital immediately, tell the doctor about the symptoms. Right approach is very important. So when you are not giving ASV, it's a criminal negligence because patient dies as a result of respiratory paralysis. Yes, anti-snake venom, बहुत बढ़िया, ठीक है. Next, आगे देखते हैं एक और. Now look at this. Here is a case of rabid dog bite. Rabid dog, very common in India. You can see here category 3 injuries are there. It is piercing the dermis. My question is, what is the best prophylaxis in this case? Best prophylaxis. Anti-rabies vaccine, ARV, 0, 3, 7, 14, 28, 5 doses, intradermal, deltoid, intramuscular, deltoid region. So this is standard care and skill during examination of patient. I hope you understood this. Okay? Chalo. Now, look at this now. Is it clear now? Have you understood reasonable care and skill with some examples? So one example we discussed is cobra bite, Wilson disease. 2 examples you can write in the exam as an explanation. Is it okay? Now, difference between civil and criminal, that is also important. Civil means Simple absence of care and skill. Very simple absence. Criminal, gross negligence. Like example, gross means wrong patient. Okay, wrong patient. Operation on wrong patient. Surgery on wrong patient. Surgery on wrong side. The patient is having kidney problem on the right side. He was operated on left side. There was a tooth issue on the right side. The dentist operated on the left side. Wrong patient. Wrong blood transfusion. Okay. Or very tight plaster leading to paralysis of the limb in case of fracture, especially by orthopedician. Okay. Wrong side, wrong patient. Leaving swab and instruments in the abdomen. So there are hundreds of examples. You can write 4 or 5. No special violation of the law here. Here willful, wanton, even culpable negligence. Criminal hai na? In criminal, the court has to satisfied with the intent, willful, wanton, even culpable negligence. Tried by the civil court, basically consumer court. Consumer court of 3 types: district consumer court, state consumer court, national consumer court. Tried by the criminal court, usually by the magistrate courts. Consent of patient amounts to good defense. So consent in civil negligence is a very good defense. It's like a Raksha Kavach. Okay, consent is equal to Raksha Kavach in civil negligence. I'll have to write in the chat box. Consent is equal to Raksha Kavach in civil negligence. Write this in chat box. Yes, बहुत बढ़िया. I'll have to write, keep writing. ठीक है. Now, contributory negligence, I said already, contributed by patient. When negligence contributed by patient, the doctor is contributory negligence. That's a very good defense in civil negligence, but not a good defense in criminal negligence. Liable to pay damages, fine. Like example, 11 crore fine, 11 crore in one case. The Kunal Shah versus Dr. Mukherjee case, the amount paid was 11 crore. Around 6 crore along with the interest, it was paid by the party, awarded by the court. 11 crore, highest compensation in medical negligence. Till date, 11 crore. Here section 304A IPC, matlab 106 BNS now. Yes, बहुत बढ़िया. Sunset is equal to Raksha Kavach. हो गया. Now look at this. Look at this newspaper headline. Identify. Doctors accidentally amputate wrong leg on elderly patient in tragic mistake. So what is your answer? Is it civil negligence, criminal negligence, or contributory negligence, or corporate negligence, or combined negligence? What it is? Come on, guys. Come on, guys. So the answer. So this is basically criminal negligence. Wrong blood transfusion, criminal negligence. Tight plaster is basically criminal negligence. Criminal, very good. Surabhi, Bhumika Reddy, Rakesh, Ranjan, Rachel clearance, everyone is answering. That's great. Doctor applies tight plaster cast on patient leg, but instruct him to report numbness. So the patient suffering from some fracture. So orthopedician, he applied some tight plaster. He asked the patient to come after 1 week. He also instruct him to report numbness if it is there. Patient develops numbness in his toes but does not inform doctor. So he was there in the hospital. He was there in the house, and later he presented with paralysis of entire limb because of the occlusion of the nerve, basically blood supply to the nerve. So suffers permanent injury. Now my question is it criminal negligence or civil negligence or contributory negligence? So here both the doctor and patient both are negligent. So what would be the best answer? Try. Okay. Try. So it's a corporate negligence. That's okay. Contributory negligence. Surabhi, the best answer is it is contributory negligence. That's great. Monisha, excellent answer. Vachel clearance, good answer. Ranjan, very good. Now the next topic is very interesting topic. Kabir Singh, Arjun Reddy. So what is the next topic? Any guess, guys, from your side? Any guess? Arjun Reddy, Kabir Singh. Come on, guys, try. So we completed one, 2, 3 short essays and one important short essay, short answers, and also we discussed a long essay as well. Medical negligence can be a long essay. So in exam you need to write defenses also. What are defenses in case of medical negligence? So one is the duty, error of judgment, therapeutic misadventure and all. बहुत बढ़िया, ठीक है. Medical misconduct, drugs. Good. So the question can be asked, what is professional misconduct? Infamous conduct. 5 marks question. 5. So it is defined as disgraceful, dishonorable, unethical behavior. Unethical. Unethical मतलब moral behavior होता है. ये क्या होता है? Moral behavior है. So the patient must be morally, doctor must be morally correct. है ना? So because the doctor is considered as next to God. So he is next to God. So he must have some ethical principles in his life. So when he is not bound to ethical principle, then it is professional misconduct. But who is going to judge it? By professional men. Professional men of good repute and competence. So it can be remembered with the help of mnemonic 6A DISCO or 6A. One is association with unqualified person and dichotomy. Unqualified person means we call it as covering. Like allowing patients or allowing some third party or someone not related to clinical practice during examination of the patient, or allowing some unqualified person in your operation theater. So that is known as covering. That can be professional misconduct. Dichotomy means fee splitting. मतलब commission देना or commission लेना. 500 is the fees, the 200 is given to the mediator, or 200 is given to some other doctor for reference. We call it as cuts business. So dichotomy means cuts. All of you right? So dichotomy मतलब 300 plus 200. Just write this. 300 plus 200. मतलब total fees 500 है. 200 goes to the one who referred him to that hospital. Cuts practice is dichotomy, and that is punishable offence under various guidelines given by the NMC as well as State Medical Council. The punishment can be suspension, it can be warning, it can be professional death sentence also. There are levels are there, level 1, 2, 3, 4 and all. Okay. Dichotomy is equal to fee splitting. Good, Rakesh, Ranjan, that's great. दूसरा advertisement. Advertisement मतलब unusual signboard, large signboard like this, very large signboard, FMT Guru, okay, FMT Guru, cardiologist. So writing like this. See, my qualification is MD in Forensic Medicine from Maulana Azad Medical College. FMT Guru, MBBS MD, cardiologist. cardiac specialist, 100% care. That is basically advertisement. That is a wrong advertisement. So that is not advisable. Have you understood, guys? Like if you are a cardiologist, you can write MBBS, MD, DM cardiology, you can write. But if I write like that, then it is infamous conduct. I hope you understanding. Yeah. Cuts. Yeah. Then are doing advertisement for some incurable disease, like Dr. S, specialist in HIV, specialist in hepatitis B. That is advertisement. They are incurable disease. ट्रीटमेंट ही नहीं है, मतलब ट्रीटमेंट है, मतलब ड्रग्स है, मतलब ऐसा एडवर्टाइजमेंट करना, 1+1 ऑफर देना, 40% ऑफर देना, तो दैट इज बेसिकली रॉन्ग एज पर द एनएमसी गाइडलाइंस. ठीक है. और एडवर्टाइजमेंट इज इंपॉर्टेंट. प्रिस्क्रिप्शन ऑल्सो मस्ट कंटेन द नेम ऑफ द डॉक्टर, qualification of the doctor, title of the doctor, and that should be all the details, and you must write generic names, not the brand names. Like example, tablet paracetamol 500 milligram thrice daily for 5 days, that is fine. So writing tablet Sinarest twice daily for 3 days, if you write Sinarest, then it is professional misconduct. You must write generic name. I hope you understanding this. Okay. Yes. Then adultery. Adultery means sexual intent. So when doctor is having sexual intent with the patient, or sometimes sexual intercourse, it can be basically professional misconduct also. It can be rape also, custodial rape, as per section 64(2) BNS. 64(2) BNS. Okay. Then abortion, like therapeutic abortion or criminal abortion without any proper indication. It's usually therapeutic abortion without any proper indication. There are 4 indications are there. So eugenic, maternal indications, socio-economic indication, and humanitarian indication. So when you are doing abortion without proper indication, without proper degree, then it can be therapeutic abortion, professional misconduct. If criminal abortion, then it is 88, 89, 90 BNS. So all of write in the chat box, criminal abortion is equal to 88, 89 and 90 BNS होता है. इसमें क्या होता है? 88, 89, 90 BNS. लिखो लिखो गाइस, आराम से लिखो, जल्दी लिखो. Come on guys, you are keep writing, keep answering, keep writing. Yeah. Then comes is addiction. When doctor is addicted to ganja, addicted to cannabis, or when he is alcohol addict, treating patient under the influence of alcohol, when doctor taking MDMA, then it is professional misconduct. Then alcohol, treating patient under the influence of alcohol, it's definitely professional misconduct. Punishment is warning, suspension, or permanent death sentence by state medical council. Okay. Bhumika Reddy, Ranjan, that's great, that's great. So this can be asked in your exam as a 5 marks question. Punishment, 3 points I said already, I am going to write again. एक है वार्निंग होता है, याद रखना वार्निंग वार्निंग नोटिस है ना, दो डिफरेंट है. वार्निंग मतलब by the state medical council. The warning notice means a notice of offences at the time of registration. All this, so there will be a notice instruction given by the state medical council. As a doctor, you must not involve yourself in these activities like association, advertisement, adultery, abortion, addiction, alcohol and all. There are hundreds of examples. Only 6 you can write in the exam, basically for 5 marks question. Warning होता है, एक होता है suspension, suspension of clinical practice, or professional death sentence. Professional death sentence मतलब permanent removal of name of the doctor from the medical register. Permanently. Like Dr. FMT Guru. From tomorrow only FMT Guru. No doctor. समझ में आ रहा है ना आपको? Dr. FMT Guru. No FMT Guru. That is only FMT Guru. So this is how the question can be framed in exam. Okay. Now, what is the proceedings in case of professional misconduct? How proceedings takes place? So there will be complaint from the aggrieved person to the SMC, like adultery, association. Aggrieved person means usually patient, or sometime advocate of the patient. Advocate, they are going to complain to the SMC, to directly to the State Medical Council. इसके बाद क्या होगा? इसके बाद scrutiny होगा. If complaint is genuine, then initiation of case against the doctor in gross misconduct. In gross misconduct, there will be hundreds of complaints every day, but SMC is going to decide, okay, this is the genuine case. Let's start initiation of the case. Then comes notice to the RMP. They will give notice. Their parties are allowed to bring any lawyer to represent in SMC or NMC also, EMRB also. Then SMC is going to dismiss the complaint. Dismiss the complaint when doctor is not guilty, or warning, suspension, monetary penalty, or removal of the name of the doctor. Can anyone tell me, so what is the appellate authority in case of suspension? In case of suspension, professional death sentence, which is the body of NMC which is going to take up the case? So definitely NMC. Which body of NMC? So there are different bodies are there. Which body is going to take up the case, or which is known as appellate authority in case of medical negligence? Can anyone? Open to all. Yes, come on, try guys. So the answer is EMRB, Ethics and Medical Registration Board, within 2 months, 60 days. So once there is a judgment given by the SMC, the doctor must approach NMC, basically the EMRB, within 60 days. So all of you write in the chat box EMRB. लिखना EMRB. EMRB, Ethics and Medical Registration Board. There are different boards are there. UG Medical Education Board, PG Medical Education Board, then also EMRB as well. Okay. Darshan Patil, that's बहुत बढ़िया हो गया. Now look at this. Oh no, I never thought Dr. Sahani is so poor in surgery. Your hand has not recovered even 5% of the surgery. So Dr. Sahani is so bad. Her treatment skills are below standard. So advising patient or talking about another doctor in front of the patient, is it professional misconduct? Is it professional misconduct or normal conduct of the doctor? Anyone? Open to discussion. So you are doctor, you are professional. There can be 100 of things, personal things between you and your colleague, but that is personal. So when it comes to profession, there must not be any ego, disrespect in terms of words, in terms of behavior, anything. So it's a purely professional misconduct. Surabhi is telling professional misconduct. समझ में आ रहा है ना आपको? Yes or no? Guys, Ranjan, this topic is a bit confusing and bit difficult as well. Okay. Next, look at this. I already discussed examining female patient by male doctor without female attendant can be an example for professional misconduct. It can be adultery as well. Also, it can be rape or indecent assault. Indecent assault as per section 74 BNS and all. Then, now look at this. Though I have told him this is simple surgery, I must tell it's a major surgery. So in the beginning it was said it's a minor surgery. Then patient died. The patient died. Then doctor is telling it's a major surgery, he died. That means it is against informed consent. As you know, informed consent. In informed consent, you must take consent after explaining every detail. Diagnosis, treatment, treatment option, best treatment, complications, everything you must explain. That is known as informed consent. You must divulge all information in general any cases. There are some exceptions, again, privilege communication, therapeutic privilege, therapeutic waiver and all. Okay, so all of you write in the chat box informed consent. Likho informed consent in the chat box. Keep writing. Rakesh, Ranjan. Informed consent involves, what are the components? All information given. What are information? First thing, the diagnosis. Okay, diagnosis. Treatment. Treatment options. Prognosis. Lastly, complications. Then you must take consent. So this is the best consent, a written consent in patient's own language, along with the one or two witness. That carries more value in any case of medical negligence. Blanket consent is punishable offense. It is not consent at all. बहुत बढ़िया, ठीक है. भूमिका, हनीक, सूरवेब, रंजन, राकेश, एक्सलेंट आंसर, बहुत बढ़िया. आगे देखते हैं. Look at this. Okay, so that doctor, he's a doctor and he is, say, patient. Imagine patient. Okay, it's like a academic image, nothing to do with the real case. So you consent to undergo blood test. बहुत बढ़िया. You undergo stress ECG as well, echo as well. Sister Hilda will help you. Now my question is, what type of consent is this? What type of consent is this? That involves consent for all things. Consent for examination, consent for all tests. At the time of registration, at the entry to the hospital, you are taking signature from the patient. Blood test, stress ECG, echo, treatment, surgery, everything. What is that known as? That is basically illegal, invalid consent. इसको क्या बोलते हैं हम लोग? Anyone can you try? भूमिका, हानिक, सूरभ, रंजन, राकेश, बेटा कैन यू ट्राई? ये क्या हो सकता है? इम्प्लाइड नहीं है, इम्प्लाइड नहीं होता. इम्प्लाइड मतलब क्या है? कंसेंट गिवन. तो इम्प्लाइड इज अ गुड कंसेंट बेसिकली फॉर जनरल फिजिकल एग्जामिनेशन, not for the blood test, not for the examination, private examination, or not for the surgery. Implied. So my question, taking consent and doing everything, taking one consent, doing everything, what is that? So Bhumika is telling, sir, a blanket consent hai. Blanket consent. Blanket consent. It is invalid. याद रखना पड़ेगा, 3 marks question है. It can be reasoning question in exam. The blanket consent is totally not acceptable. It is not a consent at all. Something goes wrong, you are responsible. Criminal negligence. Express consent, express can be verbal consent or it can be okay, chalo, ho gaya. Next, look at this. This is very interesting. 2 doctors are there. He is doctor 1 and he is doctor too. They are discussing. Thank you, doctor. Thank you very much. Excellent job. You will get 30% per case. Don't worry. So 1 lakh is the total bill. You will get 30%. Matlab 30,000 you will get. Don't worry. This is promise. This is promise. Do continue. So what is this known as? बहुत बढ़िया. ठीक है. चलो. Excellent. Many answering. That's great. Dichotomy. Surabhi is telling dichotomy. Cuts dichotomy. Good. Okay. So this completes your infamous conduct. I hope you understood this topic, guys. 3 5 marks question. Are you there? Yes or no? Okay. Fine, guys. Have understood? Professional misconduct 5 marks question. Say yes or no. Yes or no. Give me some feedback. Feedback. Okay. Okay. So the next topic from legal procedure. So there are some questions in legal procedure. One question commonly asked is inquest. What is inquest? Types of inquest. Difference between police inquest, magistrate inquest. 5 marks question. Then comes what is summon? Types of summon. 3 marks question. Conduct money. 3 marks question. Then comes is courtroom proceedings. So one important 10 marks question is duties of doctor in witness box. 10 marks question. Then sometime dying declaration, dying deposition. Sometime question can be asked about BNS, BNSS, BSA. Okay. Yes. So next topic is inquest. What is inquest and what are the types of inquest? Inquest means inquiry towards cause of death, or sometime to find out the identity in case of unknown dead body, place of crime, time of death, time since death, cause of death. Like example in hanging. So hanging is an unnatural death. The cause of death is asphyxia. It can be either suicidal, homicidal, accidental, or sometime autoerotic hanging. So as a doctor or as a forensic expert, you must conclude the cause of death. Say example, a case of hanging. Okay, case of hanging. The victim is partially naked, partially hanging or partial hanging. Mirror is there, mirror है, partially hanging state है. No history of depression, no depression है. Suffering from paraphilia present है. तो patient को abnormal sexual behavior है. So he was found with some abnormal sexual behavior like transvestism. So wearing female dress and roaming here there, sexual satisfaction, or sometimes stealing the inner garments of the female, keeping it in house. So, and he found dead. My question is, what is the manner? What is the manner in this case? You can even try. The clue is a case of hanging. Dead body was found dead in a house. The house was locked from the inside. Partially naked है, partial hanging है, mirror है, no depression, paraphilia है, dead. मतलब क्या हो सकता है? ये क्या है? सुसाइडल है, एक्सीडेंटल है, और होमिसाइडल है, और जुडिशियल है. क्या है? हाँ, रंजन इज टेलिंग सर ये एक्सीडेंटल है. वेरी गुड बेटा, वेरी गुड. ये एक्सीडेंटल है, एक्सीडेंटल हैंगिंग है. So during sexual hanging, sometime there can be loss of consciousness. Loss of consciousness leads to further asphyxia, leads to death of the male or female. It can be seen in male or female both. Yes, accidental. Ranjan, Bhumika, Surabh, Shima, Siddhika, that's great. ठीक है. So inquest मतलब there are 4 types है. Police inquest. So police inquest basically by police officer, usually by sub inspector, not the constable, not the head constable, usually sub inspector or any rank above the sub inspector like DOSP, inspector or ACP, DCP, like that. So inspector, sub inspector usually is the primary contact, you can say. So in inquest, police inquest, they are going to visit the crime scene. They are going to take the history from the relatives, statement from the relatives, statement from the neighbors. That is known as Panchanama. The question can be asked, what is Panchanama? So Panchanama means statement from the witness. 5 witness. 5 means Pancha. Nama means that is statement. So regarding what? Regarding the nature of the person, regarding the case. It can be anything. Okay. So once Panchanama is done, the dead body is usually sent into a post-mortem examination to find out the cause of death. So once cause of death is given, investigation is over. So he is going to submit the charge sheet to the magistrate. So this is how police inquest is done. ठीक है, बहुत बढ़िया. चलो next. Magistrate inquest. Magistrate usually by executive magistrate. Try to understand, it is usually executive magistrate like Tehsildar, collector, district collector, assistant collector and all. So especially in some cases, not all the cases, as per 196 BNSS. तो आपको लिखना है 194 क्या है, 194 BNSS है पुलिस इंक्वेस्ट, 196 है मैजिस्ट्रेट इंक्वेस्ट. लिखो ऑल ऑफ यू. पुलिस मीन्स 194, पुलिस 194, मैजिस्ट्रेट 196. Keep writing this. This is distinction point you need to write in the exam. Magistrate inquest done in some conditions, like example exhumation. Dowry death, custody death, custody of the police officer, like lockup death, police death of the patient in psychiatric hospital, death of person within the jail, a remand room, a remand home. So in all these conditions, in exhumation, dying, dowry death, custodial death, police firing, psychiatric hospital. So all these cases, magistrate inquest is done as per the law, as per the BNSS 196 BNSS. So in case of dowry death, the investigation usually conducted by sub-divisional magistrate or Tehsildar, not by the police, because it is superior. So magistrate can issue warrant and it is superior. So magistrate along with the police in general. ठीक है, बहुत बढ़िया. Ranjan, Surabh, that's great. Coroner's inquest. So now it is abolished. Now it is not there. It was there in Mumbai. It was there in West Bengal, Kolkata. In 1999, it was abolished. Now it is not there. So coroner inquest is conducted by the coroner. The coroner is a first class magistrate. Coroner court and all. Now it is not there. Then medical examiner in US. So medical examiner usually dual expert. He is forensic expert. He is also law expert. So he is basically forensic pathologist. So he will conduct the postmortem examination. At the same time, he is going to conduct the investigation also. The investigation, autopsy by same person. medical examiner in some states of US, Japan. Then procurator fiscal system, that is in Scotland Yard police. Now anyone, can you tell me which is the best system? Which is the best inquiry system? Which is the best investigating system? Options are police, magistrate, coroner, medical examiner, procurator, fiscal system. Anyone? Open to all. Come on, guys. Yes, Ranjan, Sorabeb, Shreyans. Come on. Yes, guys, are you there? Good. Many answered, especially by Pegasus and Monisha and Hanik, Bhumika, and all. That's great. Rakesh also. I'm very happy now. Do you want to listen some song from me today? Any song? Again, Kannada song only. Yes, guys. If you want, well, spend 1 minute on that. 1 minute. So inquest means inquiry to find out the place of crime, time of death, cause of death, identity. There are 5 types are there. Most common is the police, best in India magistrate, best in the world medical examiner. So the magistrate inquest 196 BNSS. It is normally done in 3 conditions: exhumation, dowry death, and also custodial death. Dual expert, basically medical examiner inquest in US. Procurator fiscal system like medical examiner in Scotland. Coroner was in Kolkata, Mumbai till 1999. Hope you understood this. Yes, Rakesh is telling, okay, bahut badhiya. Okay. ನೀರ ಬಿಟ್ಟು ನೆಲದ ಮೇಲೆ ದೋಣಿ ಸಾಗದು, ನೆಲವ ಬಿಟ್ಟು ನೀರ ಮೇಲೆ ಬಂಡಿ ಹೋಗದು, ನಿನ್ನ ಬಿಟ್ಟು ನನ್ನ, ನನ್ನ ಬಿಟ್ಟು ನಿನ್ನ, ಜೀವನ ಸಾಗದು, ಜೀವನ ಸಾಗದು. ನೀರ ಬಿಟ್ಟು ನೆಲದ ಮೇಲೆ ದೋಣಿ ಸಾಗದು. ठीक है? Yes. With this, now let's continue other questions, answers as well. Sure. Magistrate, I said already, there are indications like death in prison, police custody, death during police firing, exhumation, death in psychiatric hospital, dowry death, and all. So try to remember, dowry death is basically 80 BNS. 80 BNS. The punishment can be 7 years of imprisonment. So all of you write in the chat box, dowry is equal to 80 BNS. Dowry death is equal to 80 BNS. Likho in the chat box. Yes. Then what are the components of recording evidence in court of law? One more very important question, very commonly asked. Okay. So there are 5 steps are there. The first step is the basically, okay, before that, to try to identify the characters. So there are 3 main characters in court of law. So this is taken from LLB, that is a movie, very good movie actually, Jolly LLB, I think. So judge, as you know, very important character. Defense counsel or defense advocate, and public prosecutor. Public prosecutor. Now my question is, who is going to conduct cross-examination? Cross-examination. See, cross-examination is very, very important. The very important component of the courtroom procedure. It is going to identify the inaccuracy in the statement of the witness, or some weak points in the statement of the witness, or in any case of cross-examination. So, benefit of doubt usually goes to accused. Benefit of doubt. My question is, cross-examination by defense lawyer, defense advocate. Remember, cross-examination, no time limit. Leading question can be asked. Yes or no type of question can be asked. So with this introduction, recording of evidence in court of law, the first one is oath. The oath is very important component. The oath is not required in children's less than 12 years or child less than 12 years. It's not required. But in otherwise, oath is mandatory in any case in court of law. It's mandatory. Not taking oath can be a punishable offense. Telling lie under oath is equal to perjury. Perjury means giving false statement or giving false information under oath in court of law. Seriously punishable. Punishable under 227 is the definition. Punishment had 229 BNS. All of you write in the chat box. Perjury is equal to 227 and 229 BNS. लिखो, लिखना चाहिए, एक बार लिखना चाहिए. Yes, Pegasus, white official. Okay, summary. I'll let you in the next class. Surabham. 227 is definition of perjury. 229 is punishment for perjury. 7 years of punishment. 7 years. 7 years jail. Telling lie in court of law in front of the magistrate, seriously punishable. 7 साल की सजा हो सकती है. 7 साल. So never give false information, false statement, even false certificate. It can amount to perjury. Perjury includes hostile witness also. Hostile witness is a person. Perjury can be anything. It can be documentary evidence, it can be oral evidence, anything that is given in false sense. It is basically perjury. बहुत बढ़िया. Bhumika, excellent answer. This can be question. Then once oath is over, the next step is basically examination chief. Examination chief by public prosecutor. No leading question. In examination chief, no leading questions are allowed. Usually conducted by public prosecutor, government advocate. And remember, try to understand, it is to just to explain about the case to the magistrate or to the judge. What happened? Say example, a case of murder. Who was the murderer? What happened? What are the evidences? So we have evidence, DNA fingerprinting evidence is there. We have eyewitness. We have weapon examination report. Postmortem report is there. So examination chief basically to explain the facts of the case. Like example, Tandoor murder case, Bride Bath murder case, umbrella murder case, sexual assault, rape. The public prosecutor are going to explain, that is examination chief. Leading questions are not allowed. Yes or no type of questions are not allowed. Cross-examination by defense advocate, defense lawyer. Leading questions are allowed. Leading questions, yes or no type of question. Any question which has Answer in it. His length is 10 centimeter. His length of the weapon 10 centimeter. Yes sir, 10 centimeter. Leading question. Is your name FMT Guru? Is your name FMT Guru? Yes sir, my name is FMT Guru. Leading question. Are you a doctor? Yes, I am doctor. Leading question. Are you the murderer? Yes sir. So like that it is. Leading question. I hope you understood. Now I have a question for you. A question is there like this. What is the weapon used in crime scene? What is the weapon used in crime scene? Or what is the weapon used in crime? Is it a leading question, non-leading question? Bhumika, Rakesh, Manisha, Ranjan, Surabeb, Hanik. Anyone? What is the weapon used in crime scene murder? So, is it a leading question, non-leading question? Try. Come on, try to answer this. Cross-examination, remember, no time limit. No time limit. So, it can be 1 day, 2 day, 10 day, 1 month. So, it depends on the case. In one murder case, I was cross-examined for 10 days, almost more than 10 hearings, long back, maybe I think in 2014 or 15. So, cross-examination, no time limit. Okay? Yes, non-leading question, very good. So many answered, Bhumika answered, no, it's non-leading question. Excellent answer. Okay. So why cross-examination? To find out the weak points in the statement of the witness, to save the accused. इसके बाद आता है re-examination. Re-examination again by the public prosecutor. Again, no leading question. No new question, no leading question in re-examination. It is just to explain the court about the inaccuracies and about the doubts during cross-examination. Just to explain the court, so this was the doubt and this is the answer, like this. But remember, in case of hostile witness, leading question can be asked. This is MCQ point, Viva question. In hostile witness, when witness is hostile, when witness is U-turn witness, when he is not telling the truth, then court can permit leading question even during examination chief or re-examination as well. Okay, so this is very interesting question. इसके बाद court judge question. So judge, my lord, honorable judge can ask any questions at any time during the proceedings. So once all questions over, cross-examination over, re-examination over, so there will be arguments होता है, arguments के बाद judgment होता है, judgment के बाद एक होता है guilty और non guilty, मतलब guilty of offense है और not guilty, then usually there will be appeal. Okay, appeal to the higher court. So this is how the courtroom proceeding takes place. Any doubt in this, guys? Any doubt? I'll repeat again, there are 5 steps are there. Oath is the first step, examination chief is the second step, cross-examination, re-examination, court, judge, questions. Okay, no time limit for cross-examination. बहुत बढ़िया. Now I have a series of questions. You can just go through these questions. Duties of doctor in witness box, 10 marks question. 10 marks. After the class, go through this. Medical evidence. What are the types of medical evidence? What is evidence? Direct evidence, indirect evidence, hearsay evidence. What are types of medical evidence? What are medical reports, medico-legal reports, dying declaration, dying deposition? 5 marks question. Types of witness. 5 marks. There are two types of witness, common witness and expert witness. Difference is very commonly asked. Like example, eyewitness in case of murder, common witness. Ballistic expert is the expert witness. Doctor is the expert witness. ये सब बात है एग्जाम में. समन्स 3 मार्क्स क्वेश्चन है. कंडक्ट मनी 3 मार्क्स क्वेश्चन है. इजी क्वेश्चन है. कंडक्ट मनी इज पेड ओनली इन द सिविल केस. Dying declaration, very important 5 marks question. Dying deposition is also 5 marks question. Difference between dying declaration, dying deposition can be 5 marks question. BNS, BNSS and BSc. So all these are questions that can be framed in your exam. Yes guys. So last 10 minutes, so we are going to discuss forensic spotters in next 10 minutes. Are you ready guys? Are you ready for the forensic spotters? The 10 spotters are there. Very interesting spotters. Very important 3 marks questions. Reasoning question, Viva question can be framed. NEET PG question can be framed. FMG, INI CET. All these are important images. Are you there guys? Yes. Let's start. Yes, Ranjan, Rakesh, HSM, Suravib, Monisha is telling yes, sir. Okay. The first question. See, the first question, a case of sexual assault, a case of rape, 64 BNS. The age of the victim more than 12 years. She was sent to forensic department or OBJ department for the medical examination, medico-legal examination as per 184 BNSS. During victim examination, the finding is this. The finding here is there. So what is this finding known as? You can see linear lines are there, and you can see the brown scab is also there. Brown scab, that is scab formation. My question is, what type of abrasion is this? What is the age of this injury? Age. Is it consistent with the rape? Yes or no? So very good, Anil Kale, very good, excellent. So this is basically scratch abrasion. So brown scab is there. So around 3 to 4 days is the age. So 3 to 4 days. 2 to 4 days, anyway, okay. Color changes in case of abrasion, very important 3 marks question. I think we discussed in last class. Okay. Chalo, बहुत बढ़िया. The first answer by Mr. Anil Kerali. Excellent. Anil Kerali. Congratulations. Very good answer. Second question. A case of road traffic accident. Okay. Anterocranial fossa fracture is there. The collection of blood around the eye. You can see here clearly visible hematoma around the eye. It looks like a raccoon eye. What is this basically? A case of road traffic accident. The most dependent part is around the eye. It is related to the attachment of the occipitofrontalis muscle. So the blood accumulates around the eye. Migratory bruise. What is this known as? Migratory bruise. the bruise extending from one side to other side, like injury on the forehead, it collects around the eye. इसको हम क्या बोलते हैं? इसको हम बोलते हैं raccoon eye. Yes, very good, Bhumika Reddy, excellent answer. ये है black eye. The first answer by Bhumika Reddy. Excellent. That's great. Shifting bruise. 3 marks question. Now this is very interesting question. Bhaskar Shetty murder case. Udupi court awards life imprisonment to wife and son and priest. This is a brutal murder happened in Udupi district. The husband was killed by the wife and the son and the priest. Some property issue or some money matter. See, most of the things happens because of the money matter, property matter nowadays, as you know. Property issue was there. So he was killed with the help of iron rod. Then his body was cut into multiple pieces. They tried to, burn the dead body in Homakunda. After that, all the body pieces were thrown into some river. My question is, here dead body नहीं है. इस केस में क्या है? Dead body नहीं है. Corpus delicti नहीं है. How to prove the crime? Or how this crime was proved by the public prosecutor or the government counsel? Anyone, can you tell me? So this is basically murder. I said 103 BNS है. 103 BNS is equal to क्या है? Guilty mind है. याद रखना, guilty mind and a guilty act. So that's why the life imprisonment was awarded. In this case, very interesting, they got some blood stain in the crime scene. The blood stain was matched with the mother of the victim. DNA fingerprint was used. Even bone marrow was recovered from the river, 1 or 2 pieces of bone marrow. The bone marrow was sent into FSL. In FSL, it was proved that it is belonging to that person, Bhaskar Shetty. It all, decided based on the circumstantial evidence. So Bhaskar Shetty was missing. Blunt force trauma, the blood stain is there. Bone pieces were found. DNA was matched. No eyewitness in this case. It's only the confession from the accused. Good. Witness and DNA. Excellent answer. DNA examination. That's great. Okay. Now this is very interesting case. The brides in the bath case. Brides. Very interesting case happened a long back. Here accused was the husband. He was husband. He killed many victims. I think 3 or 4 victims. Brides. 3 to 4 victims. Okay. With the help of shallow water drowning. Shallow water drowning. My question is, what is the cause of death? Cause of death in shallow water drowning. Simple question. The brides in the bath case, very interesting. After the class, you just type in ChatGPT brides in the bath case. You will get all the details. Okay? Anil Kale. So the cause of death is asphyxia होता है. एक होता है asphyxia. दूसरा क्या है? So it can be shallow water drowning, asphyxia and death. There will be asphyxial signs, cyanosis, congestion, petechial hemorrhages and all. There can be froth also. If breathing efforts are there, there will be froth. Breathing efforts are not there, no froth. So in shallow water drowning, the froth was completely absent because he used to kill all the victims by holding their leg within the bathtub. So head injury and death. Basically head injury, unconsciousness, then drowning and death. So this is the sequence of the case. वेगल इनहिबिशन हाउ डायटम यार बाथटब में डायटम कहाँ होता है प्रणव डायटम्स नो डायटम कोई बात नहीं आता इसमें ठीक है वेगल इनहिबिशन बहुत बढ़िया ठीक है नेक्स्ट नाउ वन मोर इम्पॉर्टेंट मर्डर केस नाउ कैन एनीवन टेल मी what is the substance used in this murder case? This is a murder case, we call it as umbrella murder case. Umbrella. During postmortem examination, they found pellet within the thigh, within the abrasion. Some pellet was found in the dead body. What was that substance used in this case? Very fatal substance, agent of bioterrorism. The agent that is used in high-fi murders, which causes inhibition of RNA polymerase, protein inhibition and death. Death occurs in 3 to 4 days. The fatal dosage is very less, 2 mg per kg body weight. That means 100 mg can lead to death. What was the substance used? An organic irritant, type B agent of bioterrorism, which was mixed within the pellet, and it was applied over the skin of the victim and who died and who neglected the injury because it was minor injury in that case. Resin is the correct answer. Resin, bahut badhiya. Yes, Durandar movie I have seen. In Durandar movie it is dimethyl mercury used. It is also very poisonous. Dimethyl mercury. Good. Then now very interesting question. A very interesting question is Anil Kale and others. A case of road traffic accident. Postmortem examination shows some petechial hemorrhages. Histopathology there are black colored collection of axons. So the brain histopathology. Now my question is very simple for you. A case of road traffic accident, during postmortem examination, petechias are there all over the brain. On histopathology, what we can see here, collection of the axon, black colored collection of axons. What is this known as? This is the classical case of concussion injury. Concussion injury, damage to the axon because of sudden acceleration, deacceleration injury. What is this finding known as? Anyone? Surabhi, Monisha, Bhumika, Rakesh. Come on guys, Anil Khale. Anil, are you there? So this is retraction ball. Retraction ball can be 5 marks question. Okay, concussion. Then 7th question, very interesting question. In this case, the history is very interesting case. Death of young person. Okay, sudden death of young person. Presented with worst headache of life. Worst headache. Found dead after 10 minutes. Severe headache, worst headache of the life, and found dead. And the dead body was sent into forensic department for postmortem. During postmortem, there is a finding. Young person, around 22-year-old, found dead. Definitely there will be some suspicion, like poisoning, or it can be trauma, it can be head injury, whatever it is. My question, at the base of the brain, there is a collection of blood, there is a collection of hematoma. So it is present below the arachnoid matter, not below the dura matter, below the subarachnoid matter. Arachnoid matter. एक कौन सा hemorrhage है which leads to death? Okay, good. It's subdural, no beta. It's subdural नहीं है. Subarachnoid बेटा. Excellent answer. ये है subarachnoid hematoma. Subarachnoid hematoma. So bleeding vessel is Barry aneurysm involving circle of Willis, involving anterior circulation. Barry aneurysm rupture can lead to subarachnoid hemorrhage in a young person, leading to death. As a forensic expert at a medical student, you must know worst headache of the life. So I'll have to write SAH is equal to worst headache. Write this worst headache in the chat box. So good answer all. Suraveb, Hanik, Anil Khale, good. Pranav, very good. Pranav, excellent answer. Salute. Anil Khale, as usual, good answer. Ranjan. Monisha is telling sir, Barry aneurysm. Bahut badhiya. Bahut badhiya. Good. Then the 8th question. Now, 8th question is also very interesting. A case of road traffic accident. A case of death of car driver. So, car driver accidents are very common nowadays. Maybe due to alcohol, maybe due to high speed kills. It's a case of car accident, driver or front seat passenger found dead during postmortem examination as a part of 194 BNS. What I found, multiple lacerations are there, multiple laceration over the face because of the glasses, because of the mirror, because of the shield glasses, front glass. So because of the particles of the glass, which is causing multiple laceration. What is this known as? Very interesting question. You can make out here. So there are lacerations, multiple lacerations because of the broken window glass or the front glass of the vehicle, and head injury and death. It shows that he is a front seat passenger or driver. So this is excellent answer. Sparrow foot mark. So only one student answered. Rakesh answered correctly. ये क्या है? Sparrow foot mark है. Sparrow foot mark. 3 marks question. Sparrow foot mark are secondary injuries caused by the windshield glasses, characterized by multiple laceration over the face, usually in front seat passengers. 3 marks question if you write more than sufficient. Good. Due to? Yes, bahut badhiya. Next. Now this is also a very interesting question. Now this is very interesting. In this case, the husband was killed. The husband was killed by wife by using some substance along with the food, and no injuries on the body. So there are no injuries. The patient came with a history of vomiting, severe abdominal pain, and found dead after 12 hours. He was admitted to hospital. No suspicion, nothing. The only suspicion was the wife Google history. Wife Google history is how to kill a person without any injury, without smell, or by mixing with the food and drink. This was the only Google history. So Google history, you know, that's a evidence basically. Nowadays, it's a very important evidence. It can be primary evidence. Google history. Everything is evidence. WhatsApp message can be evidence. Google history can be evidence. Instagram message, Facebook message. We have advanced techniques now, advanced methods now. Anyone, can you tell me, during autopsy examination, the stomach is totally red velvety stomach, totally red. ये क्या हो सकता है? Rakesh and others. So this is basically arsenic poison. तो याद रखना पड़ेगा, arsenic होता है, that is red velvety stomach. So write in the chat box, arsenic is equal to king of all poison. Arsenic is king. Arsenic is king of all poisons, guys. Write this in chat box. King of all poison. चलो, बहुत बढ़िया. आगे देखते हैं. Last question of the day. The last question is an interesting question. A case of unnatural death. A dead body was found in a closed house. Closed house. You are staying alone. You are staying alone. Okay. He was found dead. The house was locked from the inside. No caretaker. Nobody was there. And in the crime scene, we found a dead body as well as the dead body of the dog. An elderly man staying with the dog in a closed house, a big apartment. The house was locked from the inside. No foul play. My question is, what was the probable reason of cause of death in this particular case? Anyone? So he was suffering from multiple joint problems, hip replacement surgery. He was staying alone. No kids, no relative nearby. He was always staying alone. No interaction with the society. No phone calls, nothing. He was totally neglected by the others. Anyone? ये है acute starvation or starvation death. As you know, acute starvation, the person dies in 10 to 12 days. So no food, no drink, the person dies in 10 to 12 days. If only water is there, a person can survive for about 3 to 6 weeks. 3 to 6 weeks. In this case, we found dead body of the patient. We've also found dead body of the dog as well. Both died due to starvation. So acute starvation, 10 to 12 days, no food, no water. 3 to 6 weeks when there is a water is present. Probably in this case, no water, no food. You can see the loss of subcutaneous fat. Eye changes are there. Skin changes are there. All go in favor of chronic starvation. So probably suffering from psychiatric illness or something else. Okay? Yes. Loneliness and death. बहुत बढ़िया. So this completes today's session. All 10 questions, all interesting questions, all important unnatural death. So I hope you understood. Any doubt in today's lecture, guys? You can ask me for next 5-10 minutes. So today's first topic, basically it was medical negligence, main question. Then the second important topic is professional misconduct, usually a 5 marks question. Then inquest, 5 marks question. Then we discussed about courtroom proceedings, 5 steps. Duties of doctor in witness box. Okay. Okay. ले जाओ इसे. इससे पहले मैं इसे मुर्गा बना दूं यहां पर जज, है ना? Courtroom evidence can be a question. इसके बाद all important questions are given to you. Go through this simple topics. Then we discussed all interesting case scenario. Can anyone tell me, anyone can just give me feedback, which was the most interesting case among these 10 cases today in today's class? Anyone? Most interesting, the most challenging one. So what is your thought? The most interesting, the post-mortem examination in today's class. We discussed 10 cases: starvation, husband-wife story, Bhaskar Shetty murder case, and others. Resin murder case, umbrella murder case, and all. रंजन इज टेलिंग सर अम्ब्रेला केस था ना, बहुत बढ़िया था अम्ब्रेला केस. अच्छा, भूमिका रेड्डी इज टेलिंग सर स्पैरो फुट मार्क है ना, बहुत बढ़िया, 3 मार्क्स क्वेश्चन है, स्पैरो फुट मार्क. ठीक है, गुड. योर होल क्लास इज इंटरेस्टिंग, बहुत बढ़िया. प्रणव इज टेलिंग सर स्पैरो फुट इज द मोस्ट डिस्टर्बिंग इमेज ऑफ द डे. Surabhi is telling sir sparrow. Sarah Bono is telling sir I have just joined sir. Okay, no problem. Rakesh is telling sir bathtub case. Brides in the bath case, bathtub murder case. ठीक है. Yes guys, thank you all. Thank you Anil, thank you. See you in tomorrow. Tomorrow class is there, day after tomorrow class is there. So lecture number 5 and 6, we have totally 8 lectures are there. So we completed I think 4th lecture, we have 4 more lectures. बहुत बढ़िया. ठीक है, चलो. प्रेम is telling sir sparrow foot. Okay, so this is sparrow foot. Yeah, can make out. If you want to see once again, you can just see, memorize this image. This is sparrow foot. अनिल काले, ओके, थैंक यू फॉर द क्लास. प्रणव इज टेलिंग, ओके. सारा बानो, ये देखो, ये है ना स्पैरो फुट मार्क केस.